protection of the vulnerable users, okay, or safeguarding the vulnerable users. So, with regards to safeguarding vulnerable adults, it's crucial that you allow them as much control and autonomy over their own lives as possible. Okay, if you need to confirm to ensure the 100% safety of the vulnerable adults, then the first step is to make themselves able to control their own lives, to make decisions regarding their own lives. Under the Mental Capacity Act, there is a process which needs to be followed to determine whether an adult is capable of making choices for themselves. Only if this process has been followed and it has been decided that they are unfit to choose for themselves, can any decision about care may be made without the individual's consent. Okay, so under the Mental Capacity Act, if it has been observed that the person is unable to make choices for himself, then of course, only then you will be able to take the right from the patient to decide about his treatment plan, or you can say his to decide about the safeguarding protocols. Safeguarding a vulnerable adult means making sure their lives are free from neglect and abuse, encouraging or helping them make the decisions about their own lives and care, and creating a risk-free environment. So we are actually repeating this again and again. The same thing has been explained. Safeguarding a vulnerable child. A child is classified being under the age of 18. Safeguarding children is all about protecting them from the abuse and exploitation. Yes, it is understood. Then make sure they grow up with the right care. Stop things from preventing their health and development, and take action when you believe these things could be or are already happening. Okay, so safeguarding a vulnerable child involves four main steps, means to protect them from the abuse as well as the exploitation, and to make sure that they are growing up with the right care, to make sure that certain things that are very dangerous for their health must be avoided. Take actions when you believe these things could be or are already happening. Okay, so take the actions on time whenever required. Ensure the development and care provides the best possible outcome. Escalating the healthcare cost and awareness, medical errors have drawn attention to the need of quality. So no doubt the cost of the medicine has been increasing day by day, and nowadays it's very important to make every person aware of their disease. Now, what could be the reasons why there is a need to make themselves aware? Firstly, this is their right to be aware of all the things that are doing with their treatment, with their body, and with their soul as well. Today, many efforts around the patient outcomes and safety, care coordination, efficiency, cost cuttings are underway, and care redesign initiatives are being evaluated to guide future healthcare quality. The following things may aid in healthcare. Okay, how the healthcare system must be improved? What are the different steps that should be included in order to improve the healthcare programs? Analyze your data and outcomes. Before you can begin to make improvements in the healthcare, you first need to know what opportunities exist for improvement and then establish baseline outcomes. Next, look at the trends and the statistics from electronic health records, outcome studies, and the other data source to identify the key areas in a need of improvement. Okay, so basically you need to analyze your data and outcome. You need to actually keep a check on the official things. Official things means because you are of course keeping a check on your data and outcome, so you actually need to improve them with the passage of time. Okay, you need to check on the trends and the statistics from the EHR, electronic health records. And then, of course, you draw the outcome, and then finally, you will be able to analyze the data and its outcome. Set goals. Set concrete and measurable goals in the areas you identify as most in need of the improvement. They should be precise, quantitative in nature. The Institute of Medicine (IUM) outlines six aims for improvement or pillars of quality healthcare that can guide your improvement goal setting. According to the Institute for Healthcare Improvement (IHI), healthcare should be safe, effective, patient-centered, timely, efficient, and okay. So before starting any sort of task or any sort of uh, procedure, of course, you need to set some goals. And what is the goal in this matter? The goal is to identify what are the flaws and what kind of improvements you need. Being physician, you need. There should be these should be precise and quantitative in nature. The Institute of Medicine (IUM) outlines six aims for improvement or the pillars. Okay, so IUM actually outlined the six basic things that should be done when we are about to set our goals. Okay? And according to Institute of Healthcare Improvement, all these six aims, six goals have been set. The first one is to avoid the injuries to the patient from care that is intended to help them. Okay, the patient must not get injured with the treatment plan that has been provided to them for their safety, for their betterment. Effective. Match care to science. Avoid overuse of ineffective care and underuse of effective care. Okay. So means that what kind of care should be given to the patient? It should be the effective care. Okay. Effective care means avoiding the overuse of ineffective care when you are providing the person, the patient, with the required care. Okay, then it is known as effective. Patient centered. Honor the individual and respect choice. Timely reduce the waiting for both patient and those who give care. Okay, so care provider as well as the care user. They should not give each other the tough waiting too long. Patient centered. Sorry. Efficient. Reduce the waste. Equitable. Close the racial and ethnic gaps in health status. The accurate treatment plan. The exact or the good treatment plan should be provided to the patient irrespective of his background. Okay, his background, his race, his ethnicity. Okay, these kind of things must not come in the way of providing treatment to the patient. With the next is after setting goals, create a balanced team. An effective team should be comprised of the members from different backgrounds with varied skills and experience levels. According to the IHI, Institute of IHI means Institute for Healthcare Improvement. Forming a balanced team is one of the primary steps in the improvement process. The team should include a senior leader who can advise, provide oversight, and advocate for the team. A clinical expert who has the background necessary to make informed clinical decisions and a project manager who can accomplish day-to-day tasks and keep the team track. Okay, so the team must include a balanced team must be prepared, must be compiled, or you can say must be finalized, and they all the people of that team they must be from different kind of areas, from different ethnicity, from different backgrounds, okay? And their skills should also be variable from each other. So, according to IHI, forming a balanced team is one of the primary steps in improvement process. The team should include a senior leader who can advise, and provide oversight, a clinical expert who has the background necessary to make informed medical decisions, and a project manager who can accomplish the day-to-day tasks, means the daily tasks, and keep them on the track as well. Okay, so three kind of persons are usually required in a balanced team: a clinical expert, a senior leader, a clinical expert, and a project manager. Include the human factor inputs. Human factor is a body of knowledge about human abilities, human limitations, and other characteristics that are relevant to design. Human factors engineering is the application of human factors information to the design of tools, machines, systems, tasks, jobs, and environment for safe, comfortable, and effective human use. These relate closely to quality improvement. Okay. Now the human factor inputs must be included. When what are we doing actually? Let's go back. We are ensuring that development and care provides the best possible outcome. So we are ensuring that possible best outcomes should be obtained. Okay, so for that purpose, after creating the balance scheme, we are including the human factor input as well. Human factor means the human abilities, human limitations, and other characteristics that are relevant to design. Human factor engineering is the application of human factors information to design of tools, machines, system, tasks, and jobs. It means that basically we need to utilize the human factor like the other fields, other uh, yes, exactly, the other fields are utilizing. Okay, so for that you need to design the tool, you need to purchase the machines, systems, the tasks, jobs, and the environment as well for the safe, comfortable, and effective human use. Create an executable plan. To accomplish your goals in a timely and effective manner, you must create an achievable improvement plan. Okay, you must plan that how you will achieve, how you will attain your desirable results. This includes specific measures, protocols for attaining those measurements, and the specific definitions for improvement which will be taken from your goal setting and data analysis work. Be sure to have an organized system for tracking your data and measurement. The health resources and services the Health Resources and Services Administration provides detailed instructions and steps to developing and implementing a healthcare policy. To accomplish your goals in a timely and effective manner, you must create an achievable improvement plan. This includes specific measures, protocols for attaining those measurements, and specific definitions for improvement, which will be taken from your goal setting and data analysis work. Okay, how you are improving your goal, how you are improving your task, all the things, or a complete plan must be created after inclusion of human beings or the individual. Okay. So after sorry, so when you are making the plan, when you are designing the plan, it will include the specific measures or the protocols, means the things that are important to attain the measurements. Okay. The specific measurements and the things that are responsible for attaining or uh, those measurements, and the specific definitions for improvement which will be taken from your goal setting and the data analysis work. Be sure to have an organized system for tracking your data. The means you need to be updated out the process. Okay? So you must be having the system, organized system, in order to track your data and the measurement. The Health Resources and the Service Administration provides detailed instructions and steps to developing and implementing a healthcare quality improvement plan of their design. Okay, so Health Resources and Services Administration are usually having They usually have a proper executable plan present on their website. And that too, it is about the healthcare area. Then the next would be communicate goals and progress. So now your plan is underway or your plan is completed. Be sure to communicate with your team and with your organization at large. Okay, so when your plan is done, your plan is about to get done, you must communicate with your team and the organization as well. Share milestones, both large and small, as well as setbacks. All right, so once you are done with the plan, you must communicate with your team, with your organization. Okay, so you need to share the milestones, both the large ones and the smaller ones as well. So you need to congratulate or you need to motivate those who have contributed and made an impact in your progress. And now your plan is more likely to be succeeded when the staff are engaged. Okay, so after executing the plan, the communication is very important. And now you are in a you are in a phase of implementing the plan. Research other organizations and collaborate. Certain websites such as Patient Care Link allow the consumers and the health industry workers to view hospital data and trends. Okay, there are many websites like the Patient Care Link. These websites allow these websites. Okay, these websites actually allow the consumers and the healthcare industry workers to view the hospital data. Okay, so if you need to search about the hospital data or the trend of a certain hospital, you can have that. You can get the data through the patient care link. Review the data, see which organization excel in a particular area in which you are looking to research online and in the literature and reach out to see if you can learn from their quality improvement program. Most organizations are open to sharing this information for greater growth of patients. So, okay, after communication of your goals and progress, if you need to collaborate with other organizations, you can get the data through the website patient care link. And if you think so, that it is quite important in what? In let's get back in ensuring that best outcomes will be obtained that collaborate with. Okay, so this was all about today's lecture. Any questions?
No, Miss, I don't have any question, but I believe it is sort of lengthy. The class was regarding this individual rights and all. It is
Yes,
sort of lengthy. That's what I felt. Yeah,
yes, exactly. This was quite lengthy, and it was
lengthy and elaborative. Yeah.
yes, elaborated, and there were repetitions of 2 to 3 points again. Okay, so you can please tell me the importance of individual rights.
The importance of individual right states that the rights of the employees, it not only the rights of employees, the rights of the individuals such as the customers, the patients, the staffs. It plays an importance in running an organization, running a certain uh, uh, business or a federal state, where it highlights the importance of the values, the importance of, yeah, their voice, and yes, the importance of basically the existence, the importance of people's existence, that they're being valued.
All right, yes.